From VMC Asian College Foundation Incorporated, Calran Branch. Today, I will demonstrate the medical hand washing technique. So, the medical hand washing technique helps to prevent the growth and spread of pathogenic microorganisms from individual or environment to another. Medical hand washing is usually done at the start and end of the shift, before doing an invasive procedure, before being in contact with susceptible patients, before and after having a prolonged contact with patients, and when handling their article, dressing, equipment used in this care. After having contact with a body surface, even when you're wearing gloves. Medical hand washing also reduces the risk of cross-contaminating among clients, the transmission of microorganisms to the clients and oneself. For this procedure, we would be needing a liquid soap, and it's preferable to use an antimicrobial or antibacterial soap, tap or lukewarm running water for rinsing, and paper towel for cleaning and drying our hair. To do this procedure, you must first prepare all the material such as the soap, sink for the running water, and paper towel so that we won't waste time. For this, I will be using a liquid soap and a sink in our wash area. Next, we will be assessing our hands. It is important that we don't wear any jewelries such as wristwatch or rings, as microorganisms can lodge in jewelry. Nails should also short, as short nails are likely to harbor microorganisms or scratch our patients or puncture our gloves. Next, stand in front of the sink and keep your hands as well as your uniform away from the sink to prevent contamination. Uniform can harbor microbes when it is damped, which lead to contamination of the uniform. Turn on the water. Regulate the flow of the water so the temperature is warm. Warm water can remove the microorganisms more effectively and remove less of the protective oil. Remember to not splash water into your uniform as it could result in contamination as moisture breeds microorganisms. Now, we are going to wet our hands and wrist area thoroughly to rinse organisms and dirt into the sink. Wet it by holding them together lower than our elbow to running water to allow the water flow from our wrist to our fingertips. It is important that the water runs from the least to most contaminated area. And after wetting our hands, we're going to apply our liquid soap. So in applying a liquid soap in our hands, we're going to make sure all areas of our hands cover with soap, and we're going to rub it vigorously. We're going to rub our hands palm to palm. And then after that, we're going to rub the back of our hands, each hand with palm of other hand with finger interlace. And after this, we're going to rub our palm to palm with finger interlace. And then after that, we're going to rub with back of fingers to opposing palm with finger interlocked. And then we're going to rub each thumb of our finger clasped in opposite hands using a rotational movement. All of our finger, we're going to rub it in using rotational movement, and the other one, the same procedure. And then after rubbing our thumbs, we're going to rub the tips of our fingers in opposite palm in circular motion. Circular motion. And rub each wrist opposite hand. We're going to rub our wrist so the microorganism will no longer stay. And we're going to rinse our hands with the flowing water. We're going to rinse our hands from fingers to wrist vigorously under the flow of running water, and we're going to make sure that our hands are down and elbows up to prevent microbes from being rinsed off the most contaminated part to the least. And after that, we're going to pat our hands using a dry paper towel. From our fingers, from wrist to fingers. We're going to make sure that you don't rub your hands with paper towel or single-use cloth to prevent skin irritation. And we're going to discard the used paper towel in the right container to prevent contamination or transfer of microorganisms. Now we're going to turn off the water, and then we're going to use another paper towel to turn off the faucet. Now your hands are clean and the risk of having microorganisms is reduced. But before I end this, always remember that if your hands are touched the sink, repeat the procedure. So that's how to do a proper hand washing. Thank you.